People decide healthcare based on three things, right? Quality, cost, and access. We have terrible outcomes. Like US is like plummeting in the rankings. We got like 10th place out of 10 competitors in other developed nations. And for serious things like infant mortality, maternal fetal deaths, arrhythmias. And it's so sad because our technology is breathtaking right now. That's why I'm fully confident that our model fits the way patients behave.
Welcome to Digital Health Disruptors, a podcast brought to you by Charm Health. I'm your host, Ranjini Rangan. In this podcast, clinician entrepreneurs and technologists come together to share raw, unfiltered stories of how they're disrupting healthcare and shaping the future of digital health. Welcome back, Disruptors. I am so excited to share with you today's podcast. Today, we're joined by the inspiring Dr. Paula Muto, a leader whose deep-rooted understanding of our healthcare system drives her unwavering commitment to change. Coming from a family steeped in medical tradition, Dr. Muto has challenged her experiences as a vascular and general surgeon into a bold mission to simplify healthcare and make it accessible for all. UBERDOC was born from this vision, a platform designed to strip away the red tape, connecting patients directly with specialists without the maze of insurance hurdles. And we'll find out that when faced with challenges like the steep cost of marketing directly to consumers, Dr. Muto didn't hesitate to adapt. She strategically pivoted, leveraging alternative sources of income. This ability to balance bold ideas with practical solutions has positioned UBERDOC at an exciting turning point. Dr. Muto's conviction and her adaptability is most of what makes this podcast so memorable. Let's dive in and hear how her bold decisions and innovative mindset are shaping UBERDOC's journey. Let's get started. So, Dr. Muto, welcome to Digital Health Disruptors.
Well, thank you. And it's really wonderful being here. And I appreciate all the things you said.
So you're a vascular surgeon, super busy, life-saving work. Where in the middle of all this did the idea of UBERDOC pop into your mind?
I've always been on the front lines. I've always been in solo practice and could see firsthand how difficult it was becoming for patients and for doctors. So I was sitting at home one Sunday afternoon reading the New York Times, and I read about a poor woman who twisted her ankle in New York City. She dutifully followed the path. She went to the emergency room, and the emergency room then referred her to her primary, who then sent her for an x-ray, who then referred her to an orthopedic in Stamford, Connecticut. She could not drive, had no public transportation, had a twisted ankle. So she Googled orthopedic doctors in her area, and with a 2-block radius found 20 of them, went to one, paid cash, and said, "Why can't it be this way?" And that was my aha moment to say, why can't it be this way? Why can't we make some kind of technology, some type of platform that would connect a patient to a doctor and let them make their own appointment, let them get in and pay a transparent price? And that's how UBERDOC was born.
In 2023, the average cost of health insurance for a family of 4 was over $23,000 a year. But why even pay for coverage when even with insurance, a simple checkup can cost up to $250? Plus, why all the mystery and hidden costs? For one, healthcare providers have little incentive to disclose prices, as it could lead to lower revenue due to price comparisons. Another reason is we're living longer, and more people are using the public health system, especially over the age of 65. All this, plus the cost of new technology, hospital consolidations, the increase in labor costs, have led to the lack of transparent pricing. But it wasn't always this way.
And I think that we're just in a different world. In the old days, we had something called the physician desk reference, right? Only doctors could see inside the book, right? No one had access to this book, which had all the medications in it, all their doses, and all their complications. Think about it today. You have access to so many resources, right? That you could look at your child on the spectrum and understand, because every day you're researching, every day that research is available to you. There are groups on Facebook. There's other parents that share information. So medicine has to move forward with that and understand that patients know a lot more than they used to know. And so why are we making them follow this old-fashioned path? And so I think physicians need to meet patients where they are, and this is what UBERDOC was designed for.
To me, it's so ironic. We have so many resources, and yet we don't have accessibility. Dr. Muto doesn't hold back. She explains that employer-based health insurance is a holdover from World War II, back when it was a way to retain workers. Even today, companies use health plans and flashy benefits to attract employees, from IVF services to high-end perks. With healthcare running the show in most states, she asks, are we overdue for a shift that prioritizes people over bureaucracy?
Who pays for it isn't as important as how the payment is made. Why couldn't you give a health voucher? Or why does your employer get to decide? Think how crazy it is, right? That your employer makes the choice of where you get your health care for your child. I'm sorry, but that is not acceptable. And when you go outside that network, it's criminal what the surprise bills are. We're just changing the model.
So can you talk a little bit about the business model for UBERDOC?
So the way it works is doctors join the platform and they don't have to pay a monthly fee or anything unless they need something from us, like telemedicine or some other service. So they basically can join UBERDOC, and then they post an appointment slot. And so the doctors are all just ranked by proximity and availability. So like Dr. 1 mile beats Dr. 3 miles, and Dr. Monday beats Dr. Tuesday. So if a patient needs to make the appointment, they find the doctor nearby available, and they select an appointment slot, and then they do have to sign up for the platform, but we take no information. This is what makes it cool. We don't take any data. We take just the patient's name and their chief complaint, and payment processor is handled through a third party, so we don't hold their credit cards. The people who use UBERDOC are people who are looking for convenience. They want an answer, and they are prepared to pull out that insurance card if there's something that's required afterwards.
Could you differentiate this from direct primary care?
Direct primary care is a contract with a doctor. We are DPC a la carte, right? We're just episodic, right? We're not looking at those contracts. Sometimes we get confused with that. And other times there's these larger ACO models. And again, we're not part of that either. We're not direct contracting. We're not bundling things. We're not doing the whole, you go to the orthopedic and it's the x-ray and it's the physical therapy, it's the knee replacement. We don't touch any of that. We're just the front door. We're just the appointment. We're the first date.
UBERDOC helps people see a doctor quickly without needing extra papers or waiting, like a special shortcut to the doctor's room.
The key is that we have these access points and they are outside insurance, but the price has to be transparent and fair. And that's where the rubber hits the road, because the doctor who is that autism specialist that would probably be very happy to see your child is held behind about 15 paywalls. Right? We're just offering another way to access their waiting room. They have their Medicare patients, their Medicaid patients, they have their insurance patients, they have their workflow. What we're trying to do is make it so simple that the doctor themselves could accept an appointment and get paid for it immediately. In other words, you've alleviated a lot of anxiety on the patient. They're seen quickly and they didn't have to chase insurance. That's why the price can be lower.
Say a patient goes, my right thumb hurts. UBERDOC connects them to a hand surgeon right away. The surgeon gets a notification, accepts the appointment, and a $50 hold is placed on the patient's card or HSA FSA to lock in the spot. After the visit, the doctor clicks completed, and the rest of the payment, usually $250, is processed.
It's idiot-proof. It's a level of a fourth grader, purposely built for the doctors that way, so that there's no obstacle for a patient and a doctor to connect. It's like that was the way we designed it.
And it completely bypasses insurance companies and other large healthcare systems, and patients self-schedule, as you said, for telemedicine and in person as well. And this is a specialist access without a referral.
without a referral. Most of the people that use UberDoc are patients with insurance who have PPOs because they know that they can go walk into the most convenient access point possible and not worry about network restrictions or anything like that.
And correct me if I'm wrong, is this specifically for the independent doctor?
The platform is open to every doctor. Everyone on the platform is board certified in their specialty. So when we started this, we started with only 6 core surgical specialty. And then we rapidly expanded to everyone, including specialists of primary care. And that's how we built our network. Small to mid-sized practices, specialty practices are sweet spot, right? Because they can make their decisions quickly and they can implement quicker.
Say that you check in with a cardiologist and you realize there's something serious in the MRI. You made that first appointment through UberDoc. What happens if you need to have follow-up visits?
So what happens is you meet that cardiologist, you like that cardiologist. If they're in network, great. If they're out of network, you're going to get that referral. That bond is not going to be broken. And from an office standpoint, they would have had to get your referral anyways. And from a patient standpoint, they would have had to wait, maybe go to someone they didn't like. I've been doing this for years in my practice, my vein practice. Patients come to me from the internet. They come from all over the state. They like me. They stay with me. And then if they need a referral, they get it.
UberDoc started to connect patients and doctors with a direct pay model. But marketing to individual consumers takes a lot of money they didn't have. So, Dr. Muto, I'm curious, how many people are actually using your platform each month?
We've had thousands of patients use UberDoc in the past few years, and we have lots of doctors. In the past few months, we've wound down our direct-to-consumer side because it takes a lot. It's a lot to get a consumer. The cost of acquisition for a consumer to go to your website and actually make an appointment is really high, like prohibitively high. So
marketing's expensive.
We're good at getting doctors, but you have to have some money to be able to market those doctors. Ultimately, the business model has to match your cost of acquisition with what you're getting, and none of them can. UberDoc, interestingly, because of the type of visit we have, we do decently on that revenue, but still, it's a break even depending on the specialty. We're national. There's 1 million zip codes out there. Where do you actually advertise where your physician availability is?
So they made a smart move and pivoted to government contracts. It gave them steady revenue without the heavy marketing costs. It was a perfect match. The VA provided a steady revenue stream and a built-in patient base, eliminating the need for costly advertising.
The government contracts are great because they're guaranteed the kinds of exams they are. Some of them are specialty, some of them aren't. Again, it's not exactly the model that we started on the consumer side, and I love to go pitch doctors, and I love to go to these events. I like to go and talk to doctors, but then we really focused on we have to talk to doctors who are going to join HeroCert, which is our program for this. In other words, you can't just go out and get UberDocs. You have to get UberDocs that want to do this. But for a while, I was like, everyone said, okay, Paula, just focus. You can't go and talk about saving the world with price transparency anymore. You guys focus.
So where is UberDoc in terms of funding right now? What's the plan for the next couple of years?
So we're chronically underfunded, like most startups are. But I think women startups is particularly hard. And I don't look the right way. It's just really hard.
What do you mean by that? I don't look the right way.
Oh my God, Ranjani, the 2% is terrible. It really kind of limits you significantly.
Dr. Muto touches on a tough reality for women entrepreneurs. Only 2% of venture capital funding goes to female-founded startups. It's a huge gap, but instead of being deterred, women like Dr. Muto are using it as fuel to break barriers.
And I know women in Silicon Valley have oftentimes found a beard to come into the pitches with them because I think people feel more comfortable. At this point, I have to say, I'm going to roll this back a little bit. I have wonderful investors. Most of them are doctors. And I have loads of investors because they so believe in the product and they so believe so, but they don't see me as a woman. They see me as a colleague. Very different, right? Now, the advantage is when you don't bring a lot of people in, you own a big piece of your company. So you have control, which is nice. That we have this phenomenal opportunity. We really do. It really needs a much bigger team to do this. And the opportunity is huge, huge. And no one else is filling this void.
So you're making it easier for people to get healthcare, but how do you guys make money from it?
So on the direct-to-consumer model, we make a transaction. So every time a patient completes an appointment, we make $50, right? But transactional models are tough. You need a long runway for that, right? SaaS models are much nicer, subscription models. And we've started off as a subscription model, but it was hard to keep the doctors happy and paying monthly fees when we weren't giving them tons and tons of patients, right? We were trying to build a network. So that was a conscious decision that I pulled the subscription and said, here. I think eventually we'd like to introduce that again because doctors might use us as a payment processor. But our model for the government contracts is a much sturdier model. That is just top line revenue to us, and we pay out the doctors. So we get a good margin on that. And we do a lot of work with that. For these appointments, we have to get the doctor's credential. They have to be able to do these exams. They have to do a little bit of training. And then once they're up and running, we have to match the need to where the doctors are. So there's a lot of work on our part to facilitate those appointments. We can't just take everyone in our network and say, here, join Hero Serve, which is our program for this. That's how we make money. We're making the complete appointment amounts as a top line revenue with the government contracts, which makes it much more attractive to invest.
Initially, they raised $1.5 million with a safe note, confident it would cover their needs. Success came fast. Orders poured in, and it became clear they'd underestimated the market size. What started as a cautious step turned into a massive opportunity. Now they're doubling down, aiming to raise twice the capital, with contracts secured. So it sounds like there's so much demand, but there's a bottleneck. What's been the hardest here? Is this like the, oh crap moment so far?
So now we have the government contracts. We don't have to spend one dime now to get the consumer. We have all these appointments here. So now we just have to go back to our doctor's side and just fine tune it a bit and get it. I have the best thing here and I just need this much more to get here. Our bottleneck is really 100% resource dependent. This isn't rocket science anymore. Before, when we pitched, they're like, that's great. But as soon as they got to the consumer piece, they're like, this is going to take a lot more than she's raising. She's going to need $100 million. So they ran away. They're like, I really like her. I like the idea, but it's going to take so much money to make this revenue model work, right? But now the story's changed. It's a finite amount of money that we need to be able to do this. So in the last 6 months, our story has changed. We've pivoted into this government marketplace. Now you have to just go and pitch that story.
So your story, there was a pivot, right?
Yes.
It must have been like an emotional journey. Suddenly make this decision. What did you feel was at stake in order for you to reshape this vision for UBERDOC?
So I have to say that, yes, it was hard for me to embrace this, but we made the pivot and it makes sense because it's fuel in the tank. It's the same mission, but it's just slightly different now, right? Because we're not pitching the consumer, right? It may not be as sexy, but it's there and it provides a massive service to people who need it.
Right. You're still on a trajectory, heading on an upward path.
Because as you said, this space is crowded. Right? From an investor standpoint, they put you in a bucket, right? The challenge on the digital health side, the consumer side, is from an investment standpoint, is you can be painted with the same brush. You're just another digital healthcare company. Oh, it's a telemedicine company. No, we're not. We have telemedicine, but we're not really that. Oh, it's another revenue cycle software. It's another appointment maker. No, we're really different from all that.
By focusing narrow on a particular niche, you're actually building your credibility.
One of the things UBERDOC's always had is street cred because of the doctors that support UBERDOC and that are on UBERDOC, right? That was what distinguished us from ZocDoc or Sesame. Not just anyone could be on us. And I think with our Hero Serve network, it's the same thing. We need a special group of people that are specially credentialed to do these. It's just not everybody.
Attention clinician entrepreneurs and technologists. Are you ready to revolutionize healthcare at the point of care? Discover the Charm Health platform, a perfect ecosystem where technologists and clinician entrepreneurs connect, ideate, and thrive. Visit us at charmhealth.com/Charmalot, CHARMALOT, Charmalot. Despite this pivot to focus on government contracts for sustainability, Dr. Muto has never let go of UBERDOC's original mission of serving the general patient.
Every time I present it, people come up to me and tell me stories. They tell me their story. They tell me, I couldn't get in. This was really terrible. I wish I knew. The one thing I hear all the time is regret. Regret that I didn't know you existed. We had a patient that was having stroke-type symptoms, went to the emergency room, but couldn't get into a neurologist for 6 months or something, and got in immediately through an UBERDOC and ended up, I'm not kidding you, with a brain tumor. And the doctor diagnosed it, took care of it, and the patient did fine. So that is the reason why you have the platform, right? He's like, you can't give up on this because it's too important. And that's what keeps us going. That's why we give it to the doctors without charge, because we want to make it so there's no reason they shouldn't put a cash pay patient in their waiting room. And why wouldn't they?
You understand the healthcare system so well. Clinician entrepreneurs, tech founders, they're looking to start something out in healthcare. What's your biggest lesson you've learned on this journey?
It's so exciting to be able to take everything you know as a doctor, because doctors are curious and we like to continue to evolve, and the system gets stuck and keeps us stuck. So be able to challenge yourself with it, with creating a company, finding all these new, smart, young people, testing your skills in things that you aren't familiar with, like building a platform in the agile method, for example, or marketing or a business model. And then you can see what you like and what you don't like and all of that. I think the biggest piece of advice is that it's a long time. So objective, right? It's so scientific, right? But business is not, and the startup world is very unpredictable. You have highs and lows every day. What you really want to do is spend time doing all those wonderful things that your dreams, and then you spend time like with your accountant or your lawyer, or one of the other things, I guess, piece of advice also to tell those entrepreneurs isn't about money. It's never about money. You raise money, you never have enough money. But it really is what that money comes with. If it comes from an investor that's not engaged, doesn't matter. If it comes with an investor that can connect you and network, and that's the kind of nice thing about charm. It's like it has to come with tentacles and smart people, and then that is so much better for the company.
This is the perfect kind of startup that could be funded by clinicians.
Yes, and it is funded by clinicians. It's been funded by people in healthcare completely. It's just that I love my doctors dearly, but they don't have enough zeros. So when you're trying to take this to that next level, where you're going to the consumer, going to scale these appointments, you can't do that with doctors. I love my doctors, but we can't do it. We need something much more institutional, right? Bigger. And when you get to institutional investors, that's a different equation. And you have to have the right cast of characters for that, right? And that's where we are now.
How many employees are you actually paying?
We have 3 full-time, and that's it. And we have 1 developer that's down in Brazil.
All the development happens overseas, and you manage it here, and you do the PRing, getting the funding.
We just have one developer. We developed it here with a team, actually originally out of the Ukraine. And then now we have a developer down in Brazil. Brianna does a lot of it. She was the head of the platform, and she manages it, which is remarkable, does a lot of the QA. So when we focus just on these government exams, we did just what we needed to do, right? We went into low power mode, and we're in this little watershed moment again. We brought the company down to its bare bones to get the money to go expand, because you need to be conservative. And that's the other thing, the piece of advice is that it always takes more money. And there's a great temptation to spend money on this and try this. And at the beginning, you do throw a lot of things at the wall to see what sticks. But you have to be careful. You have to be very careful out there.
Dr. Muto, I would love to have you back on 2 years from now.
Yeah, same story.
You're right. No, you're in that pivot. You've come to the bare bones, and you've had to make some serious decisions to recalibrate. And in 2 years, it'd be so interesting to see where your story is.
For the fact that we built something that someone very far away is using to find their doctor. Because again, people decide healthcare based on 3 things, right? Quality, cost, and access. Quality is always assumed in medicine. It's always assumed. But for the majority of healthcare, it's going to be the access, the convenience of access, and the price, right? Those are the only things that will drive it. That's the only things that will drive it. That's why I'm fully confident that our model fits the way patients behave.
You make it sound so simple to break through this thought process that the industry has been living through.
And guess what? What's our report card? We have terrible outcomes. Like U.S. is plummeting in the rankings, like 10th place out of 10 competitors in other developed nations. And for serious things like infant mortality, maternal fetal deaths, arrhythmias. And it's so sad to me because our technology is breathtaking right now from a doctor standpoint. So we have a very serious problem, and we keep throwing more and more money at it. And I think that it just can't keep going that way. But I do think it's simple. I think there's nothing easier than a doctor-patient relationship, because doctors have gone to school a long time. All we do is talk to patients all day, and patients are very happy to see doctors, and doctors are very happy to see patients. There's just a lot of people in between.
Dr. Muto, you've answered this in so many different ways, but if you had a magic wand, where do you see yourself in 2 to 5 years?
So I always joke, in 2 to 5 years, yes, I would love to be still the voice of this company and the voice of change in healthcare, and hoping that we can actually change things nationally. Like we could push that needle back toward the patient, bringing that healthcare dollar closer to the patient to spend, bringing healthcare closer to them, bringing those hospitals in those rural areas functional again. We can do that. Doctors are smart. They're unhappy. They like being autonomous. We could easily put doctors back in a situation as long as we support them in the appropriate financial way. There's no reason why that transaction can't be quick, simple, and without data.
Funders have been able to see your vision, and they'll be able to say, well, we need to make this much bigger than it is, make it more global.
Make it more global. The National Health System in England has a terrible report card, and it was done by actually a surgeon that worked in the NHS, did a really astute assessment. So their access points are really terrible. So an UBERDOC could really help the UK.
In a lot of ways, insurances will become part of the story in India, but everything is direct pay. You go to the doctor's office, you pay them 250 rupees or 500, and you get your service. Tomorrow you could go to another doctor and do the same.
And it's all direct access. And so in India, actually, we have a wonderful program. We work with doctors in Mumbai, really wonderful doctors who wanted to have second opinions with American specialists. And so they use UBERDOC. And it's so beautiful because the patients are theirs, and they get on a 3-way Zoom. And so it doesn't violate any laws of international telemedicine or anything like that. The UBERDOC India works really nicely.
Wonderful. Dr. Muto, I just wanted to end on a light personal question. You brought a lot of your human side out, but outside of building UBERDOC and saving lives, what's your favorite way to unwind?
I'm a rackets person. I play tennis in the summer and I play squash all year round, and I have a squash community. We love each other. We know about each other's illnesses, their families. Everyone at the squash court knows about UBERDOC. People have helped me raise money. It's just like everyone is supportive of each other. So that is how I unwind in that community of squash.
We've had such a thought-provoking conversation. Today's discussion underscored the incredible potential for healthcare. We're inspired by your vision and grateful for all the work you're doing to bring healthcare into the future. Actually, Dr. Muto, if anybody wants to connect with you on LinkedIn,
I'm Paula Muto, MD.
And to all of our listeners, let's keep pushing for a healthcare system that serves everyone better. And that's a wrap. If you've enjoyed this episode, don't forget to hit subscribe. And more importantly, share it with anyone who loves a good innovation story. You might just be witnessing the next big leap in health tech. Thanks for tuning in.